Okay, another common question we get is, what about pregnancy and bariatric surgery? And what I want to tell you from the very beginning is this is something that if you're considering, you need to talk carefully with an expert in this, your OBGYN doctor. And I would really recommend that you work with a obstetrical specialist on this if you're considering bariatric surgery and pregnancy. And the things that I try to share with my patients is the first thing, if you're considering bariatric surgery, don't get pregnant during the rapid weight loss. And that may involve the first year, the first 2 years, depending on where you've started. And that means effective birth control. Once you decide to go this path, you have effective birth control, and you maintain effective birth control until you have, with the guidance of your obstetrician, decided this is time for a pregnancy. And we say this a little bit as a joke, and by effective birth control, we don't mean prayers, burnt offerings, or animal sacrifices. I mean, we mean something modern that really works. Pill, patch, shot, IUD, something that's, that your OBGYN doctor can help make a good choice for you. We have a number of patients who come to us to try to control their weight because of infertility. This is the main impetus behind their bariatric surgery, is they can't have a family at this weight. And they've been having sexual relations for years with no form of birth control and no pregnancies, and worked for years with infertility specialists with no pregnancy, and then they have this surgery and she loses 70 pounds and whammo, she's pregnant. And that happens. And the thing that I can tell you is that as your weight loss improves, your infertility may improve. You just won't know when. And so I think a good plan is to maintain effective birth control until your weight stabilizes, 12 months, 18 months, 1 year, or 2 years, whatever it happens for you. Wait a couple of months, sit down with your OB doctor and talk with them and say, is this a good time for me to start a pregnancy, and work with your OB doctor. So wait for the weight to stabilize, effective birth control to control fertility until your weight stabilizes. And then I think it'll be a much safer pregnancy at a normal weight. I think by definition, all of our patients who are candidates for bariatric surgery, are by definition high-risk pregnancies, and it would be good to get out of that high-risk group into a normal group by bringing your weight closer to a normal weight. And we have patients who have bariatric surgery and get pregnant anyway, and that's just part of the human condition. It happens, and have beautiful babies, and we're all happy for them. And but what we know is that statistically the infant loss is higher during a rapid weight loss, and I don't think you need that heartache, and baby doesn't need that stress. And so effective birth control until your weight stabilizes, and I think you can enjoy a much safer pregnancy at that time.